Don't have it. You don't have to bother with the test. Let's just work at the basic neck rehab of this. Set the patient up in this position here, hook lying like so, and we're going to do it in 3 phases. We're first off going to passively tell the patient what we're doing. We're doing an exercise to strengthen the deep muscles within your neck there and get them working and activating well for you, and that'll help get rid of some of the neck pain we've ever to support that. Next up, we're going to guide the patient through the movement. So I'm going to get you to keep your head on the pillow there. I'm going to guide you through this. I want you to gently nod your head forward there, rotating your head forward around that axis we discussed between your ears, and I'll just guide them through it there. Hold that for 10 seconds. Then we get it back. Same again, rotating forward around that axis. And then it back. Once we get the movement right, then we're going to start worrying about are we getting a lot of scam substitution and stuff. Yeah, okay? So once we get that, go again for me. I'm pretty confident the patient can do the movement on their own. Next, could you bring up your right hand and just put it across your neck there, those strap muscles in the front of your neck. Now if you lift your head off the pillow, can you feel them getting tight? We don't want that for this particular exercise, we don't want that. Okay, so I'm going to get you to try and let me know if they get too tight there. That probably means you're lifting your head if they do, okay? So keeping your head on the pillow, or on the table, I'm going to get you to look down and rotate your head forward around the axis, just to there, perfect. Hold that for 10 seconds. And see that there, nice and soft, no big activation, it's gone, perfect. And if you look at the EMG studies, this position here, hold that for 10 and let it back. And go the same again, keep on going, give me 10 sets of that there. If we do this there, this gives us the same muscle activation as lifting the whole head would, but it doesn't give us the scone part. So it gives us the longest collar gets activated to the same extent, the same maximum, I think it's 60% maximum voluntary contraction during this exercise, but the scone doesn't get switched on hardly at all in this, yeah? So if you buy the theory that we have local and global muscles and all that, and if you're interested in that theory, this is one way of working on that, okay? To re-establish the balance between those. From there, then you start to strengthen everything else. Nothing wrong with strengthening skull and all the other superficial muscles, nothing wrong with that whatsoever. So there you go, perfect. That's your exercise there. We're going to work towards 10 holds of 10 seconds in the morning, and at night time when you go to bed, 10 holds of 10 seconds then as well. Bada bing.
That's okay for the people now to use that without the... Do you expect
absolutely, just like that is fine, that's what I'm doing. It's just Julie brought it in, so I thought it'd be rude not to use it, Jay. Thanks for that, Julie, yeah. So, like that, 10 holds of 10. They are very handy for teaching patients isometrics as well, because they can actually visually see the progress, and you can measure what they can, the force they can generate in their neck, and that has a lot of psychological benefits for the patient as well, you know, you can really mark that progress. So, that's useful there. Now, what I say is this is a very useful exercise, I use this a lot, very safe. Even if someone had a neck fracture and you'd missed it, God forbid, and I'm not suggesting you do it, but you could probably use this without doing a huge amount of damage to their neck, you know what I mean? It's not, you know, you're not getting the head of football. It's okay. Obviously you shouldn't miss that, you should refer something like that, but it's a very, very safe exercise. If someone's experiencing a lot of pain in this exercise, they're probably using a little bit too much force, they could be highly, highly sensitized, because it's a very small movement. They were probably checking text on their phone in your waiting room, and if this is sore, there's something more than a technique problem in it, isn't it? There's a bit of sensitization, they view it with a bit of threat maybe. That's just an observation I find. The other thing to note, in a poor quality study, but nonetheless I did the study, Lean and her colleagues did a study back in 2009, I think it was, where they compared this approach to just wrapping a TheraBand around your head and strengthening your neck, and both of them were equally effective. But it was a shitty study, with a sample of like 18 people and 4 dropouts or something like that, you know what I mean? It was a crap study. But likely enough, if you do any exercise, be it whatever you enjoy, or be it something like this with a bit of neck strengthening, that's going to have a positive effect for the patient anyway. So take that in mind. But with that in mind, this is a very useful exercise, and we've got evidence to support its use as well. So again, I'll just show you, feet up. First step, you're going to introduce it to the patient, tell them what it's for, and explain that it's all about control and endurance in those neck muscles, so they might feel an awful lot happening, but it's all about the control of that. The next thing is this, you're going to say, I want you to imagine this axis through your ears here, through your head, and I'm going to get you to nod your head forward around that, like you're saying, yes, perfect, hold that, and let it back. And we guide them through it first. Slide the back of your head at the pillow and look down, perfect. Because we don't want them just popping their head up or pushing their head back into the table, okay? It's not just a chin tuck, it's a different movement. Right, then get you to do it on your own. So when they can do it independently, then we add in this complication of the scam, and that works like this. Can you just put that right hand across those strap muscles there? If you lift your head a little bit off the pillow, can you feel them getting tight? And that's what we don't want for you, okay? We want you to look down. So even a highly sensitized patient should be able to do this fine, yeah? And it's a nice, gentle way to get them to start doing some exercise in the neck where they think it's going to really hurt them. It's a very gentle way to underload them so you can work into doing more loading as you go. It's a nice progression. Get the idea?
Would you give them that on its own initially before you get